Hi everyone, I am Dr. Karishmakagodu, plastic surgeon in Bangalore, and today I am going to answer a few of the very commonly asked questions about rhinoplasty surgery. So this question says, am I ever too old for rhinoplasty? So the upper age limit for rhinoplasty is about 60 to 65 years. It all depends upon the mental attitude and the motivation of a patient, whether man or woman. It all depends what they want and desire at what age. Well, up to 60 to 65 years, if you have a positive mental attitude, good medical fitness, and a good medical condition, then you are good to go for a rhinoplasty. I'm interested in having rhinoplasty but have been told that I have extremely thin nasal skin. Will my ultra thin nasal skin keep me from achieving a satisfactory cosmetic result? Well, the skin envelope of the nose is extremely crucial to decide the final outcome of the surgery. Yes, having a thin skin, a medium thickness skin or a thick skin does ultimately decide your cosmetic result. Now, it's very important to know that in a rhinoplasty surgery, even the smallest maneuver that we make during the steps of the procedure bring about massive change on the external front. So a person who has a very thin nose, we need to make very few and delicate changes in the nose, and that depends on how our expertise and our experience is with dealing with the nose. So we make sure that we handle your nose with extreme care and caution and make the slightest bit of very delicate maneuvers so that you get a good result. Definitely with a thin nose, you are about to expect a little bit more amount of bruising, a little bit more swelling because there's very less tissue between your nose bony structure and the skin, but you will definitely get a very good cosmetic results. There is a possibility of few irregularities which you may notice in the initial period. However, once the swelling subsides and the nasal skin drapes over the nose within a few months, you are likely to see the best results finally. The next question is, how old must I be to undergo a rhinoplasty? Well, for girls, we say that a minimal age of 16 to 17 years is ideal, and for boys, it is between at least above 18 years of age. Now, we believe that between the ages of 17 to 21, your facial skeleton is developing and it's taking its final shape and structure. So, it is very essential to wait for this age to undergo a rhinoplasty surgery so that your bones are well developed, your cartilage is well developed, and we are able to perform the surgery to give you the ideal result. So coming to the next question, I've decided to undergo rhinoplasty but I'm afraid of having anesthesia. What are my options? So usually a rhinoplasty we perform here is done under general anesthesia, but you do have an option of undergoing the procedure under local anesthesia or a combination of local anesthesia and sedation. It all depends of how long your surgical procedure will be, how many corrections need to be made on the nose, and how difficult your nose surgery is going to be. So before I need to evaluate you, understand what changes you want to make on the nose, and if there are very minimal changes to be made, maybe on the bridge of the nose or just on the tip of the nose, we can do it under local anesthesia. It will be a 1 hour procedure and you can go home immediately after the procedure. But if you have a lot of changes and corrections to be made in the bone as well as the cartilage, the tip, the bridge of the nose, then likely your surgery is going to be for a longer duration and you may have to undergo this under general anesthesia. A very commonly asked question is, I dislike hospitals and may I go home immediately following my rhinoplasty? Yes, you can go home immediately after your rhinoplasty. More than 90% of the patients coming to Dr. Karishma Aesthetics go home the same day after a rhinoplasty surgery. You come here in the morning around 7:30. We take your photographs, we evaluate you, check all your blood investigations. Our anesthetist looks over your reports, prepares you for the anesthesia process. After the procedure, you are awake immediately and you're more conscious and alert within an hour, and probably late evening you can go home. Okay, so another question that has come in is, I've heard there are two types of rhinoplasty, open and closed. I want the best possible outcome, but I don't know I don't want an unnecessary scar. Which type of rhinoplasty is the right one for me? So rhinoplasty surgery can be of two types. It is an open tip and a closed tip. In an open tip rhinoplasty, we make a tiny cut between the nostrils in the lower part of the nose, and in a closed rhinoplasty, the incisions or cuts are made inside the nose along the rims of the nostrils. So it all depends on how what is the extent of your nose surgery and what kind of changes we have to make on a nose. Now, I prefer personally the open tip rhinoplasty for most patients who want to change all the features of the nose, and especially when they want to change the cartilage configuration as well as the bony configuration. An open rhinoplasty gives the surgeon a three-dimensional view of your nose, and we are able to visualize your anatomy so well that we can make the change with more precision and make more precise changes over the nose. Whereas in a closed tip rhinoplasty, we can only perform very minimal maneuvers on the nose and very minor changes can be performed. Sometimes the surgeon is going in sort of blind, and we are trying to do the procedure through very tiny incisions. And again, it is the comfort of a surgeon. There are many surgeons who are comfortable with an open rhinoplasty. There could be some surgeons who are confident doing a closed rhinoplasty. But according to me, I look at the patient, evaluate your nose and decide what would be best for you. You don't have to worry about an open rhinoplasty. The scar is extremely small, and within 1 or 2 months, it becomes almost invisible. I recognize that surgical skill plays a key role in the quality of a rhinoplasty outcome. How do I select a good rhinoplasty surgeon? Now, it's extremely important that when you're looking out for a rhinoplasty, you must first look at the credentials of a surgeon. Make sure that the surgeon is experienced plastic or a rhinoplasty surgeon, and he has had enough training and expertise in the rhinoplasty surgery by itself. And you must look at their qualifications, they look at their fellowship trainings, look at a surgeon's number of years of experience, and when you visit the surgeon, please look at their before and after images of the procedures that they have done in the past. Look at their operating theatre facility and make sure they have a good operating theatre in the hospital, a sterile environment, and that will give you an overview about the surgeon. Please do not forget to read about your surgeon before you meet them. Understand what are the qualifications and understand their training in rhinoplasty especially. So the next question here is, how much does the rhinoplasty cost? And I think this is one of the most commonly asked questions we get. Well, the cost of rhinoplasty can vary, and the average cost of rhinoplasty can start anywhere from 60 to 70,000, and it can go even up to 1.5 to 2 lakhs. Now, this will all depend upon how severe the rhinoplasty surgery is, how many hours of surgery are we doing on you, what is the complexity of the nose surgery. Is the rhinoplasty going to be combined with a septoplasty, that is the correction of the nose septal deviation? And it all depends upon the amount of work that we surgeons put on your nose and how many corrections have to be done. So there is a wide range of cost in rhinoplasty, and it will all depend upon the amount of rhinoplasty surgery, the duration of rhinoplasty surgery that we are doing for you. So I've put a complete video of the cost of rhinoplasty in our YouTube channel, so don't forget to look at the link in our description below.